Are you struggling with coming back to normal lifestyle routine post contracting COVID? Then this video is made absolutely for you. The reason is you might be suffering from what is called as the post-COVID syndrome. Post-COVID syndrome is also called as late sequelae of COVID, late onset COVID, chronic COVID, and many other terms. Now, what exactly is this post-COVID syndrome? Post-COVID syndrome is generally defined by a set of symptoms and signs the patient experiences after 4 to 5 weeks of contracting COVID. This can happen in people who have had acute infection, people who have had mild infection, or even asymptomatic cases. This signs, symptoms, and clinical features of post-COVID syndrome can occur. Now, this is generally termed as by patients that they have not been able to come back to their routine lifestyle. Means what they were pre-COVID, they have not resumed their perfect health post-COVID. This is what we generally term as post-COVID syndrome. The other part of post-COVID syndrome is when a patient complains that they are having some new or recurrent onset conditions which have arisen post-COVID. Like there are some problems which they did not have pre-COVID, but now post-COVID they have these problems. So all these three terminologies come under definition of a post-COVID syndrome or a chronic COVID. Now, what exactly are the symptoms, or how we as doctors identify this post-COVID syndrome symptoms that are available in patients? So there are lot of symptoms that are available. There is a complete list of symptoms, but the most common are malaise, body weakness, joint pain, back pain, lightheadedness, headache, fever. There's arthralgia, joint pain. These are the set of most common post-COVID syndrome that the patients are experiencing. There's a complete list of these symptoms which is ever growing. The Center of Disease Control is expanding this list as they are understanding more about this post-COVID syndrome. But the most important and intriguing point to note over here is that post-COVID, our body is susceptible to multi-organ damage. What I mean is that research is still going on to study the long-term effects of having a COVID infection to heart, to lungs, to brain, to kidneys, to digestive system, to joints, to the psychiatric problems of a patient. So the research is still going on. And why this is going on is because during COVID, there was a set of autoimmune reaction that was setting in 99% of the cases. In some cases, it was strong, leading to a severe infection. In some cases, it was mild, leading to a very mild or asymptomatic infection. What I mean by autoimmune is wherein the COVID infection raised a response from the body that was damaging the own cells of the body. And this ongoing autoimmune reaction, even after COVID has finished, even after main symptoms of COVID have finished, this autoimmune reaction may still be going on inside your body and may be damaging your primary organs like heart, lungs, kidneys, brain, psychiatric illness, digestive system, the joints, and many other places in the body. And that is why it is termed as a multi-organ damage, which is being researched. Now, this is all about the theory about post-COVID syndrome. But what can you do about it? Because there's something that is happening in your body. You are not aware of it. What can you do? So what you can do are 4 things. The first thing is you should be aware of the danger signs. The danger signs are that palpitation if you feel your heart racing, or there is dyspnea, means difficulty in breathing, your blood oxygen drops, or any of these danger signs are reported by you, you should immediately consult your treating family physician or a doctor. The second thing is you should get your blood panel tests and urine tests done on a regular basis, just to check if any abnormality can be detected immediately. The third is proper nutrition. So you should increase your diet in terms of proteins and nutrients. The reason is during COVID, the body worked a lot. The COVID virus was a heavy virus in terms of the reaction it posed to your body. To regain that nutrition, it takes a lot of time. And yes, during this time, if you have sufficient nutrition in forms of more of proteins, micronutrients and macronutrients, it is good for you. And the fourth thing is consuming plenty of fluids. The importance of water is neglected. And as I say in most of my videos, that water is a solution for 60% of your problems. 60% of your problems, water is a solution. If you're an average office going person sitting at home or studying student, you should consume at least 3 liters of water per day. Calculated 3 liters of water per day. So this is all I have with respect to post-COVID syndrome, and I hope you do understand this and implement what are the precautions and implement what is that you can do about the post-COVID syndrome so that it does not hit you hard. So that's all from my side. Hope you enjoyed the video. If yes, please do like, share and subscribe, and don't forget to watch my next video. Thank you.